Hello everyone, we're going to discuss the chapter on crisis and disaster. The objectives of the chapter include differentiate between two types of crisis and provide an example of each, identify 6 aspects of crisis that have relevance for nurses, develop a handout describing areas to assess during crisis, include at least 2 sample questions for each area, compare and contrast the differences among primary, secondary, and tertiary intervention, including appropriate intervention strategies. So what is a crisis? According to Lagerquist, a crisis is a sudden event in one's life that disturbs the internal homeostasis, during which usual coping mechanisms cannot resolve the problem. So a crisis situation has a stressful event or a threat in which a person's normal coping mechanisms fails, resulting in inability to function. A crisis situation can be considered as an opportunity for growth or may be considered as overwhelming or as a danger situation. If one considers the crisis as an opportunity for growth, the person can move toward positive change. Whereas, if one feels that this event is overwhelming and is not adequately prepared, or there is no adequate situational support, the person can feel the stress rising in him and can lead to maladaptive coping and dysfunctional behavior. Other characteristics of crisis include it is acute and time limited. It usually lasts from 4 to 6 weeks, and it occurs in all individuals, and it may or may not lead to psychopathology. And crisis is personal in nature because what one considers a crisis situation may not be considered a crisis situation by another. So how one perceives the threat depends on the person's unique perspectives and coping abilities. And a crisis situation contains the potential for psychological growth or deterioration. Now we will look into what is the outcome of a crisis. In everyday life, we deal with a lot of stressful situations. Any stressful situation can precipitate a crisis. It can be a marriage, birth of a child, loss of a job, or maybe man-made disasters, or even natural disasters. They are all stressful events which can precipitate a crisis. So in order to prevent a crisis from occurring, we need to use our problem-solving skills, which can reduce how we see the threat and how we manage the stress. So a crisis situation requires the use of 3 major aspects. One is the perception of the event. Second, adequate situational support. And third is adequate coping mechanisms. Depending on how we perceive the event as an opportunity for growth or even as a challenge, or you see it as a danger. Secondly, situational support, family support, healthcare system. Do you have sufficient resources to deal with the stressful event? Third is adequate coping mechanisms. Have we used all our coping strategies? From our past experience and the present, what other new coping mechanisms can be utilized in the situations? So depending on these three aspects, a situation can lead to a crisis, or a situation can lead to a resolution of crisis. Here we are looking into the diagrammatic representation of the effects of different balancing factors in a stressful event. So when a stressful event occurs, a person's state of equilibrium is disturbed, and the person needs to restore his equilibrium. If all of the balancing factors are present, it leads to the resolution of the problem with regaining of equilibrium, and there is no crisis. If one or more of the balancing factors are absent, it leads to the problem remaining unresolved, and disequilibrium continues, which leads to crisis. So what are the balancing factors again? It is the realistic perception of the event, adequate situational support, and adequate coping mechanisms. Now we will look into various crisis theories. First one by Erich Lindman. Erich Lindman studied the grief response of relatives of victims who died in the nightclub fire in Boston. And he's understood that the grief response of everyone is equivalent to the grief response after a stressful event. And he said, if proper preventive options are directed at these patients or these persons experiencing stressful situation, these extreme levels of anxiety could be minimized and person's equilibrium can be attained. And so he proposed a crisis intervention model as an element of preventive psychiatry in the community. Next one is by Kaplan. Kaplan advised crisis theory and outlined crisis intervention strategies. So according to Kaplan, he said there are 4 phases of development of crisis. Next is by Aguilera and Mesnick. They provided the crisis assessment framework for nurses. Finally, Albert R. Roberts, he created the 7-stage model of interventions. So based on these crisis theory, most of our nursing intervention are based on these theories. According to Robert, there are 7 stages in crisis intervention, starting from a crisis assessment. During the crisis assessment, we look at what is a stressful event, how lethal it is, how much damage, physical and mental damage, did the event cost. Secondly, we established a rapid therapeutic relationship with the patient, and we established rapport. Third aspect is identifying major problems. Fourth one is dealing with the feelings and emotions. You listen to the patient or listen to the person experiencing the stressful situation. Fifth is we identify various alternatives. We explore various choices, and then depending on the alternatives, we develop an action plan. So if the action plan is able to resolve the problem where crisis resolution has occurred, and then even after crisis situations resolution, the person needs to have a follow-up plan so that the anxiety is in check. Now we'll look into various types of crisis. First is maturational crisis. Second is situational crisis. Third is adventitious crisis. Fourth is crisis reflecting psychopathology. And fifth is psychiatric emergencies. So the first one, the maturational crisis or developmental crisis, is based on Erik Erikson's 8 stages of growth and development. According to Erikson, each stage has a different developmental task that it needs to be completed, and each developmental task requires a new skill set. So if the person is not able to develop the new skill set to complete that task, it can lead to increased tension and anxiety. These crises are of internal origin, and it may reflect developmental issues. So if there is an unresolved conflict in a person, it can trigger emotions later in their life. So that is maturational crisis. Example of maturational crisis is death of a parent, retirement, birth of a child, marriage, leaving home after adolescence. Secondly, there's a situational crisis. Situational crises are events that occur out of ordinary, and they are external to the person and is often unanticipated. Example, loss of a job, abortion, death of a loved one. So these are all events which were not anticipated by the person. And depending on the degree of support you have, a person will be able to either withstand the loss or cope with the event. If the person is not having adequate situational support and inadequate coping mechanisms, it can lead to a prolonged grief. That is situational crisis. I had mentioned that there's crisis reflecting psychopathology. For example, because of an underlying psychopathology, an event can be precipitated. So that because of an illness or physical illness, the event occurring because of underlying psychopathology can also be considered as a situational crisis. Another type of crisis is known as adventitious crisis. It's not a part of everyday life. These are very unplanned and may be accidental, usually caused by nature or human-made. Example, disasters, a crime of violence, or a national disaster like a war or an act of terrorism. And finally, another type of crisis is psychiatric emergencies. In psychiatric emergencies, these are situations in which the general functioning is severely impaired and the individual is incompetent or unable to assume any responsibility. Examples of a psychiatric emergency include acutely suicidal individuals, drug overdose, reactions to any hallucinating drugs, acute psychosis, alcohol intoxication, and uncontrollable anger. So these are various situations which can lead to crisis. Now we'll move on to the phases of crisis. So according to Kaplan, we saw that Kaplan has developed various stages of crisis intervention. So according to Kaplan, there are 4 specific phases in the development of a crisis. So the phase 1 is the person has a problem. The person lost a job. Okay, I lost a job. What do I do? There's a person's self-concept is threatened. He doesn't know what to do now, which leads to increased anxiety. He tries his defense mechanism. He tries to rationalize. Maybe he'll find another job. Okay, what can I do? He says maybe yes, I can find another job. He tries to use all the problem-solving techniques and defense mechanisms. Sometimes the patient is okay, I can find another job. This is not an issue for me. So that is phase one. Here, the individual is exposed to a precipitating stressor, anxiety increases, previous problem-solving techniques are employed. Next phase is phase two. Here, he tried all the defense mechanisms, he failed. Threat persists, okay, I have lost the job, there's no job, there's no money coming in. He doesn't know how to pay for his children's school. He doesn't know how to pay for the mortgage. The anxiety increases, which leads to feelings of extreme discomfort. Okay, I don't know how to do it. Patient feels his functioning is disorganized. And he tries to use all the coping mechanisms that he has learned in the past. But no, cannot solve this issue. So once these coping mechanisms have failed to reduce the anxiety, he feels a sense of helplessness. Sometimes it can lead to feelings of confusion and disorganization. So that's phase two. Now we'll look into phase three. Here, all the trial and attempts have failed, and the anxiety is escalated to a severe level of panic. He tries to use all new coping mechanisms, tries to use new problem-solving techniques. Maybe say, okay, I lost my job, now I can concentrate on my studies better. But if effectual resolution may occur at this stage, if not, it can lead to a lower or a premorbid functioning. The next phase in the development of crisis is phase four. Here the problems remain unresolved and the coping skills have been ineffective. To manage the stress, there's overwhelming anxiety and it leads to a breaking point, and the cognitive functions are disordered, emotions are labile, and the behavior may reflect the presence of a psychotic thinking. It can lead to violence against others or even suicidal behaviors. So that is phase four. So one question, which term is most applicable to a crisis? Self-limiting, boundaries, amnesia, chronic. What do you think it is? A crisis is usually self-limiting, 4 to 6 weeks. Now we've learned that a crisis is a situation that can be resolved in one way or another within a brief period. It is self-limited. It can last from few hours to weeks. It is characterized by an initial phase in which anxiety and tension rise, followed by a phase in which problem-solving mechanisms are set in motion. Crises can become growth opportunities when individuals learn new methods of coping, or it can be a threatening situation. So now we'll look into application of nursing process and a role of nurse in crisis intervention. So first phase is assessment. Here the healthcare provider, or as a nurse, you will assess the patient, will assess the stressor and the resulting crisis, will ask the individual to describe the event that precipitated the crisis, determine when it occurred, assess the individual's physical and mental status, determine if the individual has experienced this stressor before. If so, what method of coping was used? Have these methods been tried this time? If previous coping methods were tried, what was the result? If new coping methods were tried, what was the result? Assess for suicide or homicide potential, plan or means. Assessing for adequacy of situational supports, like adequacy of support such as family or friends, or utilization of resources. Determine level of pre-crisis functioning. Assess the usual coping methods. Ability to problem solve. Assess the individual's perception of personal strengths and limitations. Assess the individual's use of substances. So it is a comprehensive assessment of a patient. An appropriate nursing diagnosis can be developed from the assessment. Then we formulate the nursing diagnosis. Some nursing diagnoses then can be applied include ineffective coping, anxiety, distress thought process, risk for self or other directed violence, rape trauma syndrome, post-trauma syndrome, or even fear. Then we formulate the outcome identification. The major goal of treatment is patient safety and to reduce the anxiety. Then we plan the intervention and then implement them. Certain things that can be utilized is to have a feeling of warmth and openness and focusing on here and now. That is basically reality-oriented approach. Then clarify the problem that the individual may be having. Encourage the patient to vent her feelings without fear of reprimand or final stages evaluation. Here we are looking if the crisis intervention has resolved the problem, have positive behavioral changes occurred, have the individual developed more adaptive coping strategies, has the individual grown from the experience, does the individual believe that he or she could respond with healthy adaptation in future, can the individual describe a plan of action for dealing with stressors similar to the one that precipitated the crisis. Thank you. Now we'll look into various modalities of crisis intervention. It includes emergency rooms, hotlines, crisis services, crisis intervention teams, crisis stabilization beds, and short-term residential services. These are few videos that you can see. Mentions about crisis services and Lifeline Network Crisis Centers in the United States. Next, we'll move on to the disaster response. Recognize the disaster occurrence and management as a global concern and differentiate among disaster types. These are the two objectives. So what is a disaster? So disaster is a large-scale crisis which includes tsunami, hurricane, wildfire, etc. So if we respond to a disaster appropriately, what are the things that we have to do? First is develop resilient communities, assess disaster factors, risk factors on a local level, extend to network and communities, extend to large societal and national programs. So that is the disaster response. There are 5 phases of disaster management continuum, starting from preparedness, then mitigation, third is response, fourth is recovery, and fifth is evaluation. So in preparedness, it happens before an event occurred to structure the response, assess the risk, and evaluate the damage. Then mitigation is attempt to limit a disaster's impact on human health and community function. Like for example, developing a big barricade of rocks and to protect the soil and protect the people from harm. Next is response, actual implementation of the disaster plan. Then recovery, focusing on stabilizing the community and returning it to previous status. And final stage is evaluation. Now we look into disaster management context. It was developed under the government cabinet, the Department of Homeland Security. So it was developed to ensure US safety. It assures immediate availability of preparedness, response, and recovery protocols. Use civilian first response professionals. Thank you. A Category 5 hurricane destroys homes and businesses in a community. How would this crisis be classified? A maturational crisis, situational crisis, disequilibrium, or disaster? It's a disaster. So it is a video on crisis intervention promoting resilience. Please watch it when you have time.